Hello everyone, welcome to this live once again. I'm Dr. Mwiti, welcome to my channel, and even before I proceed, I kindly request you to subscribe to this channel, press the notification bell so that anytime I upload any other video, any new video, you will be the very first person to be notified about it. So today I will be talking about a very common condition that in most cases, that in 80% of women, it's continuing to affect them. Irrespective of any age, this is a condition that you can easily suffer from. Today I will talk about a condition that we refer to it as a pelvic inflammatory disease. All in short, we refer to it as P.I.D. P.I.D, it's a very common condition and a condition that most of you people have ever gone into a hospital and you have ever been diagnosed with P.I.D. So today what I will be talking basically about P.I.D, I'll be letting you know what we mean by P.I.D, the causes of P.I.D, the signs and symptoms that you can present with to show that you are suffering from P.I.D, the risk factors or the things that puts you at a higher risk of acquiring this disease. We will talk still on how you can avoid contracting this disease, and finally we will talk about the treatment. So as I said earlier, what we mean by P.I.D, the P represents for pelvic, I represents for inflammatory, and D stands for disease. Now, I will, even before I proceed, I would like you to know that pelvic inflammatory disease, this condition affects only women. It doesn't affect male patients. So what we mean by pelvic inflammatory disease, having just a sketch of how the female reproductive organs looks like, these being the ovaries, and these being the tubes, and these being the uterus. So we term these are the ovary. Then we have the fallopian tubes, or what we refer to as the oviduct. This is the oviduct, and we have the uterus, and here we have the cervix, and now here we have the vagina. Now, what we mean by P.I.D, P.I.D it can affect the ovary, the fallopian tube, and the uterus. So in this disease affects both the uterus, the fallopian tubes, and the ovaries. That way we refer to it as pelvic inflammatory disease. So when it affects, what it happens, it causes the swelling of the uterus, it causes the swelling of the fallopian tubes, and it also causes the swelling of the ovaries. So that is what we mean by pelvic inflammatory disease. So anytime when you go to the hospital and you are told that you are suffering from P.I.D, what the doctor simply means, he means that either of your uterus, the fallopian tubes, and the ovaries are swollen. Now, how does this disease occur, or what are the causes of the pelvic inflammatory disease? So number one, I will say this pelvic inflammatory disease is majorly caused by a bacteria that can be transmitted through sexual intercourse. So the number one cause of this P.I.D, you can get it from a bacteria that is transmitted to you through sexual intercourse. Now, if bacteria that has been transmitted through sexual intercourse, if it happens, it crosses the cervix and it reaches the uterus, it is in a higher position of causing P.I.D. Now, the most notorious bacteria that causes the P.I.D, number one, we have the chlamydia, and number two, we have the gonorrhea. So these are the most conditions that can make you suffer from pelvic inflammatory disease. Apart from these, the sexual way. It can as well again be caused when they are the normal barrier, or when the bacteria crosses this, and maybe it's not even the chlamydia, it cannot even be the gonorrhea, then maybe it can be the Escherichia coli, something that we refer to as Escherichia coli. So in most cases, you will hear the doctors term it as E. coli. So these are the most notorious causes of pelvic inflammatory disease. Now, having realized the causes of pelvic inflammatory disease, we will now go on what are the symptoms of this condition, or how can you present, so that now people can know that you are suffering from the pelvic inflammatory disease. So here we are talking about the signs and symptoms of P.I.D. So before I proceed, I will remind you of one thing. In most cases, people doesn't realize that they are having pelvic inflammatory disease until they present, until the pain becomes so severe. So the main sign of pelvic inflammatory disease, number one, it's whereby you have the pelvic pain. You can have the pelvic pain or the flank pains. So these are the number one sign of you are suffering from pelvic inflammatory disease. So anytime that you have the flank pains and the pelvic pains, that indicates, or that is one sign of pelvic inflammatory disease. Another sign of pelvic inflammatory disease is when you have painful sex. And again, we have menstrual irregularities. So what we mean by menstrual irregularities, this is whereby you are getting your menses not in a same pattern. Maybe in 1 month you can menstruate like twice. Maybe in 1 month you receive your period on this date, and the other time you receive your menses on the other date. So that is basically what we mean by menstrual irregularities. So another sign of maybe you might be suffering from pelvic inflammatory disease, you can as well present with high fever. You can present with high fever. You can again present with the signs of shock. You can also present with dizziness. You can present with headache. Another sign of this one is whereby you have painful micturition. What we mean by painful micturition, in simple, it's painful urination. So when you go to urinate, you have that you feel a lot of pain when you are urinating. And another very common sign of pelvic inflammatory disease, it's whereby you have vaginal discharge. When you have vaginal discharge, which is smelly, right? So if it happens you have any vaginal discharge that is very, very smelly in most cases, and you realize you have maybe vaginal discharge, you have painful urination, you have painful sex. Anytime you have sex, there is a lot of pain, and you have pelvic pain. In most cases, that results, or that ends up to be the pelvic inflammatory disease. So these are the common signs and symptoms of pelvic inflammatory disease. Now, after realizing the signs and symptoms of pelvic inflammatory disease, then now, and after also you have known what causes pelvic inflammatory disease, you have known about the signs and symptoms of pelvic inflammatory disease, I will now want you to be very careful here as I talk about the risk factors, or what are the things that puts you at a higher risk of suffering from P.I.D. So remember, we said that pelvic inflammatory disease, it is majorly caused by the bacteria that can be transmitted via sexual intercourse. So, number one, that puts you at a higher risk. Number one, it's having unprotected sex. It's having unprotected sex with a person suffering from either of gonorrhea or chlamydia. So that is one major cause, or that is one major risk. So if it happens you have an unprotected sex with a person who has gonorrhea or with a person who has chlamydia, you are at a higher risk of acquiring pelvic inflammatory disease. Another risky factor, it's whereby you have multiple sexual partners. Okay, so if it happens you have multiple sexual partners, again because of exposure to chlamydia and exposure to gonorrhea species, you are also again at a higher risk of suffering from pelvic inflammatory disease. Another risky factor, it's whereby maybe you are dating or you are married to a person having multiple sexual partners. So in you yourself, you might not be having these multiple sexual partners, but what about your partner? Maybe your partner has some other sexual partners outside who are many. So if maybe you are married to or you are dating a person also who has multiple sexual partners, and it happens this person out there contract either of the STI, this person is also at a higher risk of contracting you with pelvic inflammatory disease. And another risky factor that is also playing a major cause, it's maybe history of maybe childbirth. I will talk about childbirth or maybe miscarriage. So if it happens you end a miscarriage and the doctor decided to do the manual vacuum aspiration, the MVA, what many people term it as, so after you have a miscarriage, many people term it as umeoshwa. So if it happens you have undergone this process of kuoshwa and it happens the equipment that were used, maybe they were contaminated, they can be at a higher risk of making these germs or these causative agents to cross the cervix into the uterus, hence causing this pelvic inflammatory disease. Another risky factor, it's whereby some of the family planning, and what I mean by exactly I'm talking about this one is what you refer to as the IUCD, or in layman's you term it as coil. So it can either be the copper T or the normal or the other coil. So if it happens you are using either of the copper T or you are using the other form of family planning, whichever way it's a coil, it also has a higher chances of making you contract the pelvic inflammatory disease. So those are the risks those are the things that puts you at a higher risk of contracting the pelvic inflammatory disease. So how you can do to avoid these pelvic inflammatory disease? Number one, what you can do, it's to make sure that you are not having multiple sexual partners. Any other way you can do to avoid this disease, it's you make sure that your partner is not having multiple sexual partners. And another thing, it's by having protected sex, making every time that you are having a protected sex. Any other way that you can avoid or you can try to avoid this disease, it's whereby maybe you communicate with your doctor about the best family planning method. If you can avoid these coils, then again you are at a better position. So that's how you can avoid contracting also pelvic inflammatory disease. Now after that we will talk on, now after you have been having all these symptoms, you have gone into the hospital, and maybe the doctor decides now, let us screen you to realize or to know if you have this pelvic inflammatory disease or not. So if it happens, you go into the hospital, we have like three major tests. We term them as the diagnostic techniques. These diagnosis techniques, number one, which is very common, is the ultrasound. So you have an ultrasound. In layman's, it's a scan. So you have a scan. We can also have the endometrium biopsy. So we can take a part of your endometrium and we take it into the lab. But the very most common and even the very most convenient is the ultrasound. So if it happens you have an ultrasound, it will be able to show. Now, if it happens you have ever taken an ultrasound, when you read your ultrasound, there is somewhere reported like no free fluid in P.I.D. All maybe free fluid in P.O.D. Now, if you have ever undertaken any ultrasound and you see these ones like no free fluid in P.O.D. all free fluid in P.O.D. What we mean by P.O.D., this P.O.D. stands for pouch of Douglas. So that's what this P.O.D. stands. So for us to diagnose that you have pelvic inflammatory disease, there must be some fluid in pouch of Douglas. So if it happens you have any fluid in pouch of Douglas, then that one suggests that you have pelvic inflammatory disease. So if it happens maybe you undergone a scan, then go back to that report and check whether it is written any of the above, either no free fluid in pouch of Douglas or maybe it is written free fluid in pouch of Douglas. So if there is any fluid, then you diagnose yourself that you have pelvic inflammatory disease. Now, the ultrasound is the most convenient way, and that is the most available way of diagnosing pelvic inflammatory disease. So when we come on to treatment, we can the number one treatments we can give injections. These injections can either be intramuscular or intravenous, but the very most common or the most accurate about this treatment, it's whereby we give intramuscular. And then we also give you oral medications. We also give you oral medications for 2 weeks. We can also give you oral medications. You take them for 2 weeks. Now, when we talk of injections, the most common management is whereby we give you intramuscular Rocephin. Intramuscular Rocephin 250 milligram start. So what we mean by this one, it's one by we give you an injection into your gluteus muscle, or maybe we give you an injection into your back. The 250 milligram of it start is just a single. Then we can also combine it with oral. The per oral, we can decide to give doxycycline 100 milligram twice a day for 2 weeks. We can also give you per oral metronidazole 400 milligram 3 times a day for 2 weeks. And of course, we give you a painkiller, which most of the time is we can decide to give you maybe we can decide to give you Brufen 400 milligram 3 times a day. That is for only 3 days. So this is the basic treatment that we use to treat with the pelvic inflammatory disease. Or we can even decide to substitute all these medications with IV. We can decide to substitute. We can decide we will not use any of the oral route. We will give you the intravenous or the injections treatment until it is cleared. So it is advisable that every time when you have been treated of pelvic inflammatory disease, after maybe treatment and you have stayed at home for like 1 week or for like 10 days, it is always advisable that you go back to the hospital again so that you can have another ultrasound to confirm that this condition was successfully cleared. And again, let me say that one of the complications and one of the major complications of pelvic inflammatory disease is that it causes infertility. So if you have this pelvic inflammatory disease that has not been treated for long, it is in a position of causing infertility. It can as well cause a chronic lower pain, whereby you will have pain in your lower abdomen for too long. If this pelvic inflammatory disease has been there for so long, in most cases, it also causes miscarriages. So these miscarriages, again, can also result from the pelvic inflammatory disease that has been there for so long. So even before I complete my video, I want to remind you that anytime you have these symptoms, and I want you to check on them very carefully. Number one, if it happens you have painful sex, anytime you have sex there is pain. And in this pain we classify it into three. There is a pain when during penetration, there is pain during thrashing. What I mean by thrashing is during that pumping in and out, if there is that pain. If there is pain during penetration, during penetration, that's the only time we feel pain. That's how we classify all that sexual pain. And number two, if it happens you have vaginal discharge. If it happens you have vaginal discharge, and this vaginal discharge in most cases it is smelly, right? So, and again, when you have menstrual irregularities, and again when you have pelvic pain, or you have the lower abdominal pains, that one is also another major cause. And also when you have painful urination. So in this order, if it happens you have every time you have sex there is pain, you have this vaginal discharge which is very smelly, you have the menstrual irregularities, or you are getting your menses in different patterns, you have pelvic pain or the lower abdominal pains, you have painful urination. If you have these symptoms and maybe more like headache, issues with the chills, issues with the fever or hotness of the body, you need to seek medical attention as soon as possible to rule out maybe where if you have pelvic inflammatory disease or you does not have that condition. Although with this presentation with vaginal discharge, menstrual irregularities, pelvic pain, and maybe painful urination, they also have some other conditions like the urinary tract infections. When you have this vaginal discharge, you can be having other conditions like maybe trichomoniasis. You can have issues with the yeast infections. It is always good when you have all these, some of the presentations here, you need to go to the hospital so that the doctor will clearly rule out where you are suffering from so that he can initiate the best medicine for you. Now, in next video, we shall do another very common condition that is in most cases is still affecting our women. And now that marks the end of my video today, and until next time I will come and do another video. Kindly, if you have not subscribed to my YouTube channel, consider subscribing, hit the notification bell so that anytime I update any video you will be notified of it. You can also like, comment your views. If this video was helpful, I request you comment, and if you have any other question you can still ask the question in the comment section, because I will answer. And kindly please, you can also share this video with very many other friends, invite many other friends, because this channel, it's all about female health, and I will be talking about everything concerning female health, and I believe it will be helpful for you. So until next video, I say bye bye.